Good day. And I heard there was one question which was image based on inguinal hernia surgery. Students are very sure it was the operative field of a hernia surgery, and there was a vein structure that was asked to be identified. So the options were whether it is a testicular vein or the inferior epigastric vein. Now, the other options are not even available for me to narrow down the correct answer. So this NEET recall, what we decide, it is impossible to get a verbatim stem and a verbatim options. They are image based. Students have to decide what surgery it is about. So multiple feedbacks will be coming from students regarding the stem and the options. And then finally, you have to distill them. So at best, you can imagine the image based on the questions and the student feedback. Maybe there was a stem to direct you that it belongs to a hernia surgery. So ultimately what happens, the idea is to work around the theme and get some clarity. So that in future, when you do get questions on hernia, that to vascular structures in hernia surgery, you will be able to handle it. So the only option left is to revise all vascular structures which are encountered in an inguinal hernia surgery. Now, as I told you, all these images belong to my personal collection, and I keep repeating, please don't use your these online platforms to be surrogate for your clinical experience. So now, to talk about the vascular structures, the most important structure will be your inferior epigastric artery, which is on the posterior wall of the inguinal canal. I've taken this class as the inguinal canal as seen intra-op. It is there in my playlist. So the most important artery or the vascular structure they will ask is the inferior epigastric artery, because it's a landmark there. And I don't know why a testicular vein was asked, or if at all it was asked, quote unquote, but I will take you through the process. So vessels encountered in an inguinal hernia repair. Now, unless I show you a sagittal section of the inguinal canal, you cannot remember the vessels that you will encounter. So when you do an open repair, you're going to encounter vessels in the various parts of the wall, the various layers of the wall. That's why I've put it purposely like this in dashed arrows, because you're going to encounter vessels in the various walls, some here, some here. The posterior wall vessels can best be seen by laparoscopy, because you'll be seeing this area from behind with your laparoscope, whereas the open repair, your work will stop the moment you reach the posterior wall. Now let's go. Let's see the vessels lurking in the various layers. So now a quick recap. You have vessels in the abdominal wall. The abdominal wall skin has to be supplied. All the time we think inguinal hernia starts here. No, the inguinal canal starts here, but the inguinal hernia surgery starts from the skin. This much you have to take home. So you have vessels in the abdominal wall, in the skin, in the abdominal wall. Then when you get into the canal, you have the spermatic cord, and it will have its own vascular structures. I did not say artery and vein. I said vascular structures. Then there is another important structure, vessel here, which is your inferior epigastric, straight on the transversalis fascia. And beyond the transversalis fascia, you have the testicular and the iliac vessels. So you will be encountering these till you go to the hernia posterior wall in the open repair. And when you do the laparoscopic repair, you will only look at these vessels. You will not even be able to see these. This much I want you to take home. So coming to the anterior abdominal wall, not the anterior wall of the inguinal canal, anterior abdominal wall, you will encounter three vessels. They are the superficial epigastric, superficial external pudendal, and the deep external pudendal, and the circumflex iliac artery. Now, these two, this and this you may not encounter in your hernia surgery. I'll tell you why you will not encounter in your hernia surgery, because your incision will be somewhere here. You may not encounter these vessels, but you must know you can if your incision is going to extend. In case your incision is being extended for some reason, you might encounter this vessel, and for some reason it got extended medially, you might encounter this vessel. But deep external pudendal you will not encounter because it is below the inguinal ligament. Now let's have a look, and these vessels will be in the skin. You see, they are in the skin along with the veins. So if you look here, you can find out the bluish structure. It is just in the skin. That is the superficial epigastric. As I told you, the superficial epigastric is the only vessel you will counter in the skin. So that is the vessel. If you go medially or laterally or extension on the skin, you might find the other two vessels. Okay, fine. Now, coming to the cord structures. This is the canal. You have the cord inside. So you'll have the venous drainage and the arterial supply. Now, what exactly happens? If you look at it keenly, the venous supply is a plexus of veins in the inguinal canal up to the internal ring. So it is not one single vein. It will be a plexus of veins. So you can't find one single structure. So what you find, the venous structure along with the cord in your inguinal hernia surgery, is the pampaniform plexus. So have a look. You can see this bluish bunch here. This is the pampaniform plexus. What about the arterial supply? The arterial supply also is usually into small branches splaying over the cord structures. You might not find an exact pulsating testicular artery. It will not be a single branch. It would have branched off into very, very small branches. Then, if you really want to see these two parent vessels, you need to go posteriorly. You will see them in your laparoscopic surgery. So, if you want to see the parent vessels of the vein and the parent vessel of the artery, you need to go into the laparoscopic approach. Let's keep it at that. So, what you're seeing in the cord is the pampaniform plexus. I really don't know what exactly was the stem, what exactly was the options, but I do know it was a hernia surgery and it was something to do with the venous structure. Okay, so this is, it's not my personal experience. This is a reference from Gray's Anatomy. The pampaniform plexus forms at the scrotum and continues as the testicular vein. It becomes the testicular vein at the internal ring only, not in the canal. You may see it only in the laparoscopic approach, not in the open. We'll come to it later. Now coming to the posterior wall, it's a great landmark, which is your inferior epigastric artery. Fine. So you see the posterior wall here. You get the cord structures coming out through the internal ring and the inferior epigastric, which is medial to the internal ring. Now have a look here. Come close. Pulsation. You can see this is actually the inferior epigastric vein. Inferior epigastric vein will not be a network, it will be a single vein. And you can see the artery pulsating there. Artery is very small and pulsating here. And how do you know it's the inferior epigastric vein? Inferior epigastric vessels, you will see that there is enough depth. That means the surgeon has approached the posterior wall. The superficial epigastric artery was just in the skin, but here you see the complete depth. See how much of dissection has happened to go to the posterior wall. So if you find something deep, it's the inferior epigastric vessels. You find it just at the beginning of the skin, just below the skin. It is the vessel supplying the wall, abdominal wall, which is your superficial epigastric, circumflex and the pudendals. If it is bang inside the cord in your inguinal canal, then it is a pampaniform plexus. So now coming to the posterior wall, you have the gonadal vessels and then you have the iliac vessels. How do you see? By going into this space through your laparoscope. I've taken a separate presentation on laparoscopic hernia repair. Please check it out. So then you find, see, you will not find things blue here, unlike in an open surgery. Number one, there is a thick fascia on top. You don't have to dissect that fascia to make the vessels visible. No need. The moment you dissect the fascia, you will produce some injury to the vessel wall. You don't want that to happen just because you want to demonstrate the vessels there. You know the bulges, these are the vessels. You keep far away from them. Just because you want to demonstrate, you will not be demonstrating them. If it is a thin fascia, then you find the blue color. It's easy. But if it is a thick fascia, you can only see the bulge in the posterior wall. Now, a quick recall. Please don't rush into the images. Stay with me. So, vessels in the anterior abdominal wall, which you will encounter by putting the skin incision, will be your superficial epigastric. If your incision goes laterally and medially, you might encounter the pudendals and the circumflex. You can find a small artery here, which is just in the skin. So, you know it belongs to the abdominal wall. Coming to the vessels in the spermatic cord or in the cord structures, they will be the pampaniform plexus. It will not be a single vein. You can see the whole thing is a bunch of bluish structures. And most of the time your testicular artery will not be pulsating. It will be already into smaller branches which do not have visible pulsations. Coming to the structure, the vascular structure on the fascia transversalis or the posterior wall is your inferior epigastric, which is your landmark in hernia surgery, and you will find it here. This white thing, actually, please don't run through the slides. It is actually this structure. It was pulsating in your video. This is the inferior epigastric vein, very prominent here, but it's never used as a landmark. And coming to the gonadal vessels, you will find them in the laparoscopic. It is marked here, so I'm not going to show again. The two groups of vessels will be crossing each other. So these are the vessels which are encountered in a hernia surgery. These three in a open repair, and only this. Maximum you can imagine the inferior epigastric artery. It is there. You can see the bulge, and this only in the posterior approach. So I hope things have become clear now. So thank you very much, and I hope it has brought some sort of clarity. We have looked at the vascular structures encountered in an inguinal hernia surgery from anterior to posterior. So please keep this in mind. Hernia surgery, something very superficial, which they are unlikely to ask. I have a feeling it was the inferior epigastric artery or the inferior epigastric vein maximum, because they are the landmarks, and the landmark is only inferior epigastric artery. The vein would have been there very prominent beside it. That's all. But I think the focus was on the inferior epigastric artery. Even if it is the testicular vein, very, very unlikely to find a single vein in the inguinal canal. It will be the pampaniform plexus. It might look up like a single vein and a bunch. So I really don't know the options. So I thought I will take the whole theme as a complete picture, and I hope it brought some clarity. Thank you so much.